This is the 1576th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. AMI.C.SHAH. Let us begin the session with
hello.
1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi. As you all know, that session was a brilliant one today. And every day the sessions are going in a good way. And this from the second session, that's an international session that begins from 8:30 to 9:30. And the third session, that is a local language session in Malayalam, which begin at 9:30 to 10:30. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again, and you can subscribe the same without paying a penny, as well as you can share it with your friends so that homeopathy will be reaching at every household in the world. Let me come to today's presentation. We have here with us Dr. AMI.C.SHAH, the Assistant Professor, Sri Mahalakshmi Mahila Homeopathic Medical College, Vadodara, Gujarat. And she has completed MD in Homeopathy, Materia Medica. And she has more than 3.5 years of teaching experience and nearly 7 years of clinical experience. Last month, on the 23rd of last month, she has presented a session here on magnesium group medicines in homeopathy. Today, she will be talking about the second part of the same subject. So hope all of you will be here and she will be enjoying the session. And as we are celebrating the Xmas, Christmas from today onwards. So wishing you all happy Christmas and New Year. And let us proudly invite Dr. AMI.C.SHAH to the session. Welcome.
Thank you so much, sir. Greetings to one and all present over here. In last session, I had discussed the group symptoms of homeopathic group, one of the most important group, that is magnesium group. And today I will be continuing the same topic with more light on the individual drugs of magnesium group. Last time in last session, I would just quickly revise what we had discussed in last session. The mental aspect of magnesium group, the main theme, that is repression, feeling of being abandoned, orphanage feeling, which is very core theme of magnesium group of remedies, and which we come across in almost all magnesium group of remedies, that is magnesium carb or magnesium mure, or magnesium phos, or any magnesium group. This core feeling remains the same. You have lots of fears, sleep disturbances, insomnia, vivid dreams. Either either in magnesium group, sleep, there are lots of dreams, or you have no dreams at all. So all these were the basic concepts. And apart from this, we had also discussed the physical symptoms of group symptoms of magnesium group, correlating it with the physiological actions of the magnesium, that it has action on GIT, it acts on important action on liver, nerves, right? So that were the points which we had discussed. Now coming to the individual remedies of magnesium group. Today I've tried to cover important remedies, that is magnesium carb, magnesium mure, magnesium phos, and magnesium sul. Right. Apart from that, there are many other remedies belonging to magnesium group, that is magnesium fluor, magnesium bromatum, magnesium iodatum, magnesium aceticum. So first of all, I would like to discuss magnesium carb. So magnesium carb when I talk about the spheres of action, it is particularly, it has action on mucous membranes, mucous membrane of respiratory tract, mucous membrane of GI tract, wherein what we see, it increases the secretions of the mucous membranes. Uh, GI, when I talk about stomach, you have increased secretions leading to acidity, and hence we study the symptom, that is, you have sour irritations. Sourness is very characteristic feature of magnesium carb. All the discharges, whether it is vomiting or uh, stools or perspiration, everything is sour. And in this context, when I talk about sourness of the discharges, magnesium carb, we can compare it with calcareous carb as well as rheum. Now, rheum is again another very important remedy for ailments during dentition. And magnesium carb as well, we have ailments during dentition, difficult dentition. During dentition, that uh, the milk is undigested. It is passed in undigested form. Similarly, in rheum also we have this sourness of the older discharges. Even in spite of being washed, the SARS cannot be washed
क्या
off
नाम है
easily.
ऐसे
So
होम्योपैथी
now, foremost section, that is GI system, respiratory system. Again, you have discharges which are thick discharges, offensive discharges. Liver affections, magnesium carb acts on liver, producing here liver pains, enlargement of the liver. Next important action is on nerves, but obvious because magnesium group has a great affinity for nerves. So nerve is affected, wherein you have, especially now magnesium carb has affinity for nervous affection, supraorbital and infraorbital neuralgic affections with pain, sharp shooting pain, which makes the patient very restless, compels the patient to get up. Right? The pains are very severe. They are aggravated by draft of air, aggravated from cold, aggravated from touch, and the pains drive the patient out of the bed. Patient has to move continuously to get relief from the neuralgic affections. So these are the important spheres of action of magnesium group of remedies. And another important spheres of action when I talk about, that is female genital organs. Genital urinary tract is affected, and menstrual complaints with severe dysmenorrhea. You have severe colicky pain before menses, even headache before menses, and these flow is usually more at night, and the flow is again dark, offensive, pitch pitch like discharges which are difficult to wash off. Even the perspirations are also very sour, and they are difficult to wash off. They stains the linen, and that is difficult to wash off. So here, uh, excuse. So magnesium carb, in clinically, magnesium carb can be thought of for gastric and intestinal catarrhal affections with sour irritations, flatulent stools, diarrhea. You have increased secretions. Rectum as well, we can see that increased secretions, and we have diarrhea and stools. Again, there are that is described as like tallow-like particles floating on the water, whitish stools, chalk-like stools, sad smelling of the stool, with associated again with severe colicky pain in the abdomen before passing stools. Now, when I talk about this white chalky stools, another important remedy, again, which comes, that is Sina. Sina, again, like magnesium it has whitish stools with severe colicky pain. The child is very irritable, cranky, but then this is again a differentiating feature. Magnesium carb, you have pacifism. The child is not getting love and affection. So in all the way, the child is adjusting, trying to adjust to the circumstances. Whereas Sina babies are very irritable, very snappish. So in that way, we can differentiate magnesium carb and Sina very easily. Uh, Another important clinical utility of magnesium carbonate is toothache, severe toothache neuralgic pains in the teeth, which is aggravated at night. Uh, Again, pains are so severe that it compels a patient to get up of the bed and walk about, and the pains are usually tearing, drawing type of pain, which are aggravated at night, and pains are ameliorated for a short time by holding cold water in the mouth. And again, over here we have remedies like coffea, toothache for coffea, chamomilla. All these remedies are again can be compared over here. But again, there are some differentiating features as well. So it is easy to differentiate. And the most important utility of magnesium carbonate toothache, particularly ailments from cutting wisdom tooth or wisdom teeth affections, especially during pregnancy, that it leads to severe pain, right? And I had a case wherein a lady developed this severe pain. She had eruption of wisdom to pregnancy. During pregnancy, during she was unable to take any painkillers as well because it was a seventh, eighth month of pregnancy. She consulted me, and on this basis, I gave her Mag carb, and it just relieved with 2 doses of magnesium carb. The toothache got relieved, and she was quite better. So this then magnesium carb cravings and desire. When I talk about magnesium carb has peculiar craving, an inordinate craving for meat, especially in children of tuberculous parentage. You have violent thirst. Thirst is increased for water, especially in the evening and at night. And sleep. Physical generals, when I talk about the sleep, again, that is unrefreshing sleep. Patient is more tired on when he wakes up, very ill-humored, ill-tempered, especially when the patient wakes up. That is very peculiar thing about the sleep of magnesium carb. Another thing, yeah, potatoes and starchy food, that is disagrees. Cabbage disagrees. All these things leads to GI disturbances, causing sour irritations, flatus, indigestion, accumulation of flatus, and that is passed off undigested. Another thing, milk. Milk is passed in undigested form. Patient cannot digest milk. That is another particular physical general important symptom of magnesium carb. You have colicky pain, severe colicky pain before stools, rumbling in abdomen, colicky pain, which are better by passing flatus. Stools, you have diarrhea. Stools are frothy, greenish, whitish stools. Sometimes there is constipation as well, wherein you have frequent ineffectual desire to pass stool, or only flatus is passed for days together. There is no stool, no movement of the bowels, and which leads to stitching pain in the rectum and anus. And menses, we have already discussed that your menstrual discharges flow is acrid, thick, pitch dark, like dark, which is very difficult to wash off, and then it has a peculiar sour smelling, offensive smell from the menstrual discharges as well. And before menses, we are, the female premenstrual syndromes is very peculiar. As we all know that magnesium carb and calcarea carb again comes very close when we talk about the constitution as well. Both have similar constitution, similar uh, the symptoms are also symptomatology also goes very parallel. But the premenstrual syndrome, calcarea carb as well as magnesium carb both have, but it is well marked in magnesium carb when I compare it with calcarea carb. Calcarea carb also have that acne before the menses. Magnesium carb, again magnesium carb also will see that you have acne, pimples on the face before menses, which leaves disfigurement. The scars, which it leaves scars behind, which is not so in the case of calcarea carb. And before menses, we have symptoms like coryza, obstruction of the nose, and severe labor like pains, colicky pain in the abdomen with weakness and chilliness. So this is all about the important utility of magnesium carb. I'm not going into details of the mental genders, because that I had already discussed in the previous session, the core theme of magnesium. It remains the same for all magnesium group with some minor differences. Right. So the next remedy which we are going to discuss, that is magnesium chloride of magnesia, MgCl. Again, prover Dr. Henneman has proved magnesium carb. When I talk about the spheres of action, magnesium mure again has action on GIT and liver, predominant actions on liver, GIT, and uterine affections. It is particularly suited to women with spasmodic and hysterical complaints who have suffered from attacks of indigestion and biliousness for years together. Overall impression when I talk about magnesium mule, that is great exhaustion, yeah, conflict, objection to conflict, nervousness. So all these things prevails in magnesium mule. Magnesium mule, particularly, it is important uh, utility, clinical utility is constipation and liver affections. Liver affections with constipation is one of the most important clinical manifestation of magnesium mure. And constipation, when I talk about magnesium mure, it is very similar to natramure. Natramure and magnesium mure both have similarity in constipation. Again, at the level of mind also we have some similarity. Natramure also have that emotional dependency. They are very, very emotional, very sensitive. Magnesium mure also have that sensitivity. They are so much sensitive that they would even avoid to watch TV shows where there is lots of violence. So in this aspect, both remedies are going parallel. But at the level of mind, magnesium mure, repressed emotions are very characteristic. Whereas in natramure, what we see is suppression of the emotions. And while taking case, that suppression would definitely be reflected on the face. While narrating the symptoms, mental symptoms, or while taking case, that is reflected on the natramure person and the face, we can see, we can identify that there are suppressions. There is the patient has that depression, and suppressed emotions coming on the face. Whereas in the case of magnesium mule, we have repressed emotions. Patient is not aware of those emotions. That the emotions are being uh, 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 suppressed to such a level that the patient now is unaware that at time the patient person was being affected by such rejections. Yeah, that is very basic, very important differentiating feature. While case taking, we can definitely understand that this is a matron patient or this is magnesium patient. Magnesium mule constipation stools are very hard, knotty stools, um, difficult to evacuate, requires great straining. Stools crumbles at the verge of the anus, right? And it requires lots of efforts. This is very similar to natramine. Liver affections, enlargement of the liver, fatty liver changes, grade 1, grade 2, in all these conditions, magnesium mure has great utility. There is severe liver affections. When I talk about liver affections, there is severe pain. Liver, liver is enlarged, sore and painful. Uh, the pains are aggravated by lying on right side, and pains are relieved by lying on left side. Pains are better by pressure. Now, along with liver affections, we also see cardiac affections associated with liver affections, wherein what we see is palpitation which occurs at rest, but are better by movement, better by motion. So, liver affections with heaviness in the region of liver, with stools difficult, which are difficult to evacuate with pain, which is aggravated on while lying on left side, with jaundice, liver affection complicated with cardiac affections. We can think of magnesium mule. Magnesium mule again has neuralgic affections and headache. Headache is severe pain in the forehead, above the eyebrows. There's bursting pain, which is aggravated uh, which is aggravated at night. Patient feels better by strong pressure and by wrapping up the head warmly. Now, when I talk about wrapping up the head warmly, silicia is another remedy which comes into our mind, wherein you have the pains which are better. Patient wants to wrap the head warmly. Headache, which is better by wrapping up the head warmly. Silicia, but the silicia headache location is peculiar. We have right-sided occipitofrontal headache and better by wrapping up. Again, magnesium, ure, silicia, here another similarity apart from this is profuse perspiration, especially on the head. Right. So the similarities, this has strong similarities between silicia and magnesium mule. But peculiar modality, that is what we find headache, which is relieved by tight bandage, that is by pressure, which is not that prominent in silicia. Headache with coryza, respi affections, we have violent coryza, uh, fluent coryza, alternating with stoppage of nose. Again, over here, it is similar. This symptom we find in nux vomica as well. Nux vomica, what we see is you have fluent coryza during daytime and stoppage of nose at night. The discharges would be in magnesium mule, the discharges are yellowish, offensive, corrosive discharges with sensation of obstruction in the nose and oozina, ulceration of the nostrils, ulceration at the edges of the nostrils, as well as oozina. In cases of oozina, also magnesium mule has utility. Neuralgic affections and toothache again, you have severe pain, which is aggravated when food touches the teeth. Dentition, yes, dentition, slow dentition, with complaints of distension of abdomen and constipation, and there is inability to digest milk. It is passed in undigested form, Lientrix stools. Patient is hungry, physical, another other physical genders which are important, that is hunger. Patient is hungry but doesn't know for what the patient is hungry. There's ravenous hunger. This is followed by nausea, vomiting. Then we have desire for sweets, desire for vegetables, and aggravation from salt or salty things. Again, this magnesium ure has aggravation in seaside as well, which leads to profound prostration and weakness. Pressing pain in the liver region, which is aggravated when walking, when touching it, aggravation by lying on right side. Liver affections with hemorrhoids, with much irritation in anus, and we have chronic induration of the liver, pressive pains with dirty yellowish discoloration of the tongue. Face is yellowish discoloration of the face with distended bowels, hardness, stools are hard, and with pressure and heaviness in the abdomen. So in all, when I try to uh, come to the crux, so liver affections are very prominent, very important about magnesium, magnesium mure. With magnesium mure, I had a case of liver affections, fatty liver grade 1. Uh, with magnesium mure, I had very good results. The pathology was reversed, and following within 3 to 4 months, when I did the USG, was repeated again, and that was normal. So liver affections are very important. Another important thing is uh, muscles. When I talk about muscles, there is like weakness of the muscles, and this is very profoundly seen in urinary bladder muscles. It produces atonicity of the bladder, resulting into difficulty in voiding urine. Patient has to press a lot. That is before urinating. Has to strain a lot before urinating. And again, menstrual complaints, severe abdominal pain, aggravation in the backache with the pain, radiating in the thighs, which is aggravated when sitting, with paleness of the face, with great debility, and with nervous excitement. And leukorrhea, the vaginal discharge, again they are thick, watery, offensive. Leukorrhea after stools, leukorrhea after exercise. And respiratory affections, uh, dry cough, uh, with aggravation at night, and evening aggravation with burning and soreness in the chest. Now, the next remedy which we'll discuss, that is magnesium phosphate of magnesium. It has never failed in cases of neurologic affections. The essential characteristic of magnesium phos, acute crisis, pains which are paroxysmal, cramping, stitching type of pain which appears and disappears suddenly, and which are aggravated, which are better by pressure and better by warmth, better by bending double. Whether it is case of dysmenorrhea or neurologic affection, sciatica, all arthritic pains, all these pains, the character remains the same. Severe lightning like pain, spasmodic pains, uh, stitching type of pain, which are aggravated from exposure to cold, aggravation from change of weather, approach of storm, and the pains are relieved from heat and pressure, bending double. So neurologic affections of head, of ears, with which are better by heat and better by pressure. In gastric affections as well, there's flatulent colic, which is relieved by bending double, better by pressure. Cholecystitis, inflammation of the bladder, gallstone colic, renal colic, all colicky pains, wherein we get this peculiar modality, which the pains are relieved by pressure, by relieved by warmth. MAGFOS is infallible; it would never fail. Spasmodic affections without febrile symptoms, severe colicky pain, whooping cough, cramps in calf muscles, spasmodic affections of asthmatic breathing as well. MAGFOS has its utility. Flatulant colic, again compelling the patient to bend double. Patient and the pains are better by warmth and pressure. Colocynth is another remedy wherein we need to compare MAGFOS, but MAGFOS usually we have right-sided complaints. Colocynth we have left-sided complaints. Colocynth modality, pains are aggravated 4 to 9 p.m. and one peculiar causation of colocynth, that is ailments from indignation. Then chilliness, fever with chilliness which runs up and down the spine, again which is similar to gelsemium with shivering, and chill is aggravated from list uncovering. Again over here, Nux vomica, Rustox, these are the remedies wherein chill is aggravated by list uncovering. And modalities patient, as we have already discussed, that pains the worse from cold air, cold water, better by heat, better by warmth, better by pressure, and better by bending double. Cramping, for crampy pain, MAGFOS, apart from MAGFOS, colocin as well as cuprum. Cuprum mat also has this crampy pains. Cuprum mat is also one of the important remedy for crampy pain in legs, in calf muscles, for epileptic conditions as well. Cuprum is one of the important indicated remedy. And another important, apart from spasmodic affections, magnesium phos is important indication. Another important indication is enuresis with nervous irritations and urine. There's excess of phosphate in urine. Then magnesium phos can be thought of. Uh, Next, that is magnesium sulf. Magnesium sulf, it is proved by Nenni, remedy especially indicated for gastritis, cholecystitis, cholelithiasis, diabetes, and there is alteration in alternating symptoms, constipation and diarrhea alternates together. The most important indication of magnesium salt, that is irritations, where foul smelling irritation, frequent irritations, tasting like bad eggs, for fullness, distension in abdomen, hardness even after moderate stools. There is great rumbling in abdomen with passing of flatus and stools, alternate diarrhea and constipation with uh, stools. It is also indicated for vomit station as well. Magnesium salt can be thought of. Magnesium salt complaints are aggravated in the morning. Aggravation undressing and complaints are better by rubbing, better by walking. There's great thirst. It has diuretic actions. There's great thirst with diuretic action, and hence it is one of the important remedy for diabetes mellitus. Magnesium iodine, small remedy, which is indicated for menstrual complaints, uh, goiter, thyroid affections, and menses again, or like other magnesium remedies. Magnesium iodine also, we have menstrual flow, which is dark, leaving indelible stains which are difficult to wash off. We have some rare remedies like magnesium lacticum. Magnesium lacticum, again here GI affections, thyroid affections. It is useful for thyroid affections, particularly hyperthyroidism, crampy pains, colicky pain, neuralgic affections, hyperthyroidism, hypoglycemia. These are the clinical utility of magnesium lacticum. And magnesium lacticum, again, right-sided of affinity, we have fear of aggression, fear of criticism, dreams of falling, tendency to suppression, emotion. There's mood swings and suppressed emotions. Aggravation, morning aggravation, 7 a.m. aggravations, 5 p.m. aggravation, periodicity of the complaints. All these things can be seen in magnesium lactic. And of course, skin affections as well, eczema, eczematous conditions as well. Magnesium lacticum is useful. Another rare remedy, that is magnesium nitricum. Magnesium nitricum, it has a utility in heart affections, particularly arteriosclerosis, claudications, cerebral hemorrhages, as well as hyperthyroidism. It can be thought of. Hyperthyroidism with hyperventilation, with feeling of being suffocated. And again, the migration theme again is over here seen that fear of dreams of falling, fearful dreams, and fear of narrow spaces. All these things can be seen in magnesium nitricum. And apart from this, another utility of magnesium nitricum is in joint affections, inflammation of the joint, especially of hands, with congestion, swelling, and stiffness. So this has few remedies which are a few important remedies of magnesium group. So I would like to discuss a case. Um, I hope everything is clear. Is there any confusion or query? Can I proceed with cases?
Yes, we can go ahead with the cases if you
Okay.
are.
Uh, Magnesium. Okay, one cases. First case is of neuralgic affections. 55-year-old male patient presented to me with complaints of a pain in right side of the lumbar region, which was radiating down the thighs. The pain was spasmodic in character. Suddenly, the patient developed pain after overlifting. So reports were done. That was reports. A patient had already came with the reports. He had taken painkillers as well, but there was no much relief. So patient came to me for consultation because he has severe pain, which was aggravated. The modalities were very peculiar. The pains were aggravated by motion, and pains were relieved by pressure and relieved by heat. By warmth application, the pain was were getting better. So over here, I had because two peculiar things like aggravation from least motion. So I had bryonia as well in my mind. But then the modalities and the right-sided affinity, which drive me towards magnesium phos. So I prescribed magnesium phos 200, three pills in water potency, repeating every 15 minutes initially. And if once there is relief, slight relief, then increasing the duration, repeating it at intervals of 3 to 4 hours. So in this case, within 2 days, like the patient had a relief. Within 3 hours, patient started having relief, and later on, gradually, I tapered off the dose, and patient was completely fine with magnesium phos. And till date, he has never developed again the complaints of sciatica, that acute sciatic pain. So this was again a very good case of magnesium phos. Another case wherein that was a case of young boy, uh, 19 years, 19 or 20 years age. He presented to me with complaints of cold cough, cough. Investigation, like I asked, he was complaining of cold and cough on and off since more than 3 months. He had consulted allopathic physician. He was on antibiotic. He was put on antibiotics, but there was no relief. Again, he used to develop the complaints again and again. On further interrogating, what I found that patient had weight loss. Right, over a period of time, patient has lost weight. Patient also had complaints of difficulty in breathing, chest pain, dyspnea on exertion, and evening rise of temperature. So this with this information, I just asked him to go for X-ray lung as well as Montauk's test, because I suspected it to be a case of tuberculosis, because that the duration was very peculiar and the patient was having dry cough. More than 3 months, he was suffering no effect of antibiotics. So the reports, I asked him to undergo investigations, which of course were positive. Montauk's test was positive, and X-ray was suggestive of uh, lesion, tuberculous lesion in the right lobe of the right lung. I further interrogation, like when I was taking history, a very interesting history. What I got is a patient has a very bad childhood. He was the parents never gave him love and affection, and he was believed to be bad luck for them. They used to say them on face that you came with a bad luck, because I think father or mother, father lost his job after the birth of this child. So they used to believe him unlucky, and he was treated like that. From very young age, he was sent to hostel. This child was staying in hostel since the age of 14 years. He was staying in hostel, and there was no contact with the parents. parents never used to call him. Whereas when he used to stay in the hostel, other children got calls from the parents, but he never received call from the parents. So that level of repressed emotions were found in this case. So again, the theme, and then physical particulars here: perspiration, offensive perspiration, and the lung affinity of magnesium with desire for meat. This was a Muslim patient again. A guy was a Muslim. He had desire for meat. That was again physical particular, but that was peculiar thing which I found. And on this basis, the on the basis of whole essence. Now, when I understood the essence, that, and when this very important, right? When it comes like this, there was no suppression. The patient was talking in a very normal way, that as if he is being used to all these things. In what while describing this all this his childhood trauma, he didn't had any facial grimaces of sadness. That was very peculiar of magnesium, that repressed emotions and affinity towards lung with marasmus. Again, that magnesium group has that affection of nutrition leading to malnutrition state. So considering all these things, I prescribed him magnesium mute, and with magnesium mute, there was gradually improvement. The patient started regaining the weight. Patient started improving there was improvement in the physical complaints as well. The coughing, the chest pain, that also decreased to a great extent. And uh, of course, patient I had not discontinued the treatment protocol for tuberculosis. So those medicines were continued, but the duration was very less. Within 6 months, he was able to stop the medicines with no remissions, and patient was completely fine. Emotionally as well as physically, patient was well. So these are the two important cases of magnesium. Uh, I think that is all from my side.
Thank you, Dr. Shah. It's really a very good session. You have covered all part of the uh, magnesium group remedies, and your case is also very good. Unfortunately, even suffering through a cold, you continue the session without making any interruption. That is something great. That is that much of dedication from your part to promote
That is
homeopathy.
again a beauty of homeopathic remedies. Yesterday I had very bad. I was unable to speak. I was thinking whether I would be able to take the session or not. But then I had faith in homeopathy, and with homeopathic medicines, today I am able to speak. My voice is clear. But otherwise, I had very bad aphonia yesterday morning. But
Uh,
with God's grace and with homeopathy, it is just going.
Exactly. This is that we want to tell to everyone that this kind of dedication, determination is the need of the hour to promote homeopathy, and this is the kind of love for homeopathy that is why you really done this job. If there is some if there were some other person, they could have called me and they may say that, oh doctor, I am having this much of cold, I am not ready to present, even I cannot even talk like that. Then naturally we will have to change an immediate makeshift. We will have to take an immediate makeshift arrangement for that same. Even though I tried to call you, but unfortunately I couldn't connect you. And if I call you in the morning, definitely, if I may have called you in the morning, definitely I may request you to take rest like that, because that much of suffering you have. But here again, some of the remedy that came into the picture, or the causticum is one of the remedy, or naxomica, that may be the remedy, or ammonica may be the remedy, or maybe you are the right person to choose the remedy. But this is the typical nature of causticum, I think, that even They always forget about themselves, and they get involved with the general thing. That is also a nature of homeopathic remedies. Anyway, congratulations for your determination and courage to come up with such presentation, even during suffering. Now I invite, it is a time for discussion, and Dr. Manoj to add something more to this. And then those who are interested in commenting, or those who have any doubt about these cases, you may raise your hand so that we can have a discussion or have a question to Dr. AMI.C.SHAH. Welcome.
Thank you, Dr. Thanesh and Dr. AMI.C.SHAH. As you mentioned, it was a really fighting situation. So you won that fight. Which was a remedy you took?
Yes, yesterday I took HEPA for 30 in repeated doses, and so with that I was better. I was able to speak today at least.
Yes. In situations, we must remember Bonnier sense the five group medicine, aconite, spongia, heparacel.
And HEPA, yes.
Yes, that's from experience. The words of experience. Then another thing is that the tricholdar remedies, heparacel, the Naxomica, causticum, heparacels. These are
HEPA.
well, this type of generalization is good. Then also you just mentioned about this different groups of medicines. It was initiated a couple of years back. I think Bonnier is Farrington is the first person to start a generalization of medicine study. So each and every medicine has got its own nature. Every group has got its own nature, so that we can easily identify, because we know that the number of medicines is more than 3,000. In the earlier days, our syllabus, it was only 150 or below 200 medicines are studied. Even though we studied 200 medicine, we are not familiar with even the 20 of them. That much is the complexities. But what is more important is that the mechanization is most important thing. To stay in the profession or in the world, economically or financially, we need some mechanization. So there is a great scope in homeopathy to adopt such artificial intelligence systems as well as the representations. So in the recent years, the young persons like you always using these methods, that is, you will be able to get more success than the early generations. Moreover, you are all studying, not stopping with this BHMS or graduation or post-graduation, always continue studying. Then what about this repetition as well as the dose, then the attenuation in such cases?
In first case, as I told that I had repeated in water potency. Initially, for first 3 hours, it was every 15 minutes, and then improvement had started. So then after I had tapered up the dose to every 1 hour, and then later on every 3 hours, and then I stopped the medicine with improvement. Another case of magnesium mure, that is tuberculosis case. In that case, I had given uh, magnesium mule 1 m, one dose every week.
Yeah.
Because I that every what I believe that every action, this is a defecting remedy. I cannot repeat that frequently in such cases. I have to repeat it in infrequent doses. So what I preferred initially, I gave it in 1 m once a week, and then gradually then I tapered up the repetition to every 15 days. Then a patient was on SL.
And another important point is always we should remember about this attenuation. So always don't give medicines in dissolved in water. First, it is better always dry upon tongue. Only in emergency cases, dissolve medicine in water. That's the most important thing. The attenuation always causing aggravation. Knowingly or unknowingly, a lot of physicians, they just follow the traditional way. They dissolve in water and give them administer medicine. The selection is the right one, then definitely it will cause aggravation. Anyway, wonderful this selection and wonderful work. Hope you are early recovering. Thank you.
Thank you.
If anyone have a doubt, you can raise your hand, or you can directly come to the question. There is nobody is. Yes, definitely this kind of studies in group is very. We have compared the natron carb with calcareous carb, magnesium carb with calcareous carb. Then these are all working in the same way, but there are a basic difference in between. Uh, Doctor, usually we used to prescribe natrum, not magnesium muriaticum in conditions of separation conflict. Usually people, when somebody was there in the home and when then parents get transferred to in another city, then there is no way to take this child to that city. Then they may put the child into some hostels or sometimes in some other home. So in those conditions, there is a separation conflict develop in the child, and as a result, the child may suffer a lot. In those conditions, magnesium muriaticum works wonderfully. Am I right, Doctor?
Yes, basically the main essence is revolving around the separation issues, not getting love and affection. Uh, the he the need of the child is at that stage is getting love and affection, which he is deprived of. It can be because of divorce of the parents, or because of circumstances wherein they are forced to put him in the hostel, or it could be unwanted child, out of wedlock, orphanage. These are the situations which would give wherein magnesium comes into play.
I think the magnesium carb is a leading medicine because Ken's Materia can
Yes.
describe the clandestine born child.
Yes, he
Uh,
has very well
yes.
explained it, in Kent's Materia Medica, the orphanage, and he has used himself. What he told that unless I didn't use magnesium carb till then, in spite of giving proper nutrition, food, everything was corrected, but still there were no improvement in the cases of marasmus. They were deteriorating day by day until he gave magnesium carb. He found the utility, and so that is a very well described remedy by Dr. Kent.
Exactly. This is the importance of studying the mind of each and every patient, and why that is as we as homeopaths we have a duty to find the cause behind the illness, and some no patient will come and say that, doctor, I have this problem due to this separation. No. But when you interact with the child or the parents, they may give the description that when all these things started. Oh, doctor, I remember this thing when I was transferred to Delhi. I have to take my since I am taking so a lot of medicine. I need the support of my wife, so I took her to my home to Delhi. And since the child is a brilliant one, I don't want to change his studies from the local school to Delhi. So not only that, there may not be a big, it is very difficult to find a good school there. So I just left him in the village itself with my cousin brother's home or some other hostel like that. Then we can understand what was the cause behind this problem, why the child become less interested in studies, and how his marks become reduced to what he was getting in the early part of his studies period. So this kind of interaction is one of the very, very, very important aspect, as well as the penetrating power of the doctor into the patient's life. That is very, very important for
In
getting.
case of tuberculosis, if I had not got into the detailed history of this picture, I would be unable to reach to magnesium mute, because there are so many remedies coming to my mind for tuberculosis of lung. But and that was again when I restudied the whole like magnesium. That was the case which made me go through entire magnesium again. And with that, I got again a very clear vision of magnesium, perceiving that the vision I got that was from this particular case.
So I think the study on the textbook, the lectures on material is most desperately needed.
Yeah.
But
Yeah.
unfortunately, around 99% of our physicians are always following the boric material only, I must say. There are hundreds of material, brilliant works are there.
There are lots of books, and I think every author has given a beautiful insight into each and every remedy. So it is very important. It's not like I can study Materia Medica from only one book, and that's the reason we have different books to get a insight, proper insight. Like it's not every time I can prescribe only on the basis of mentals or only on the basis of physical generals. I need to understand everything. Only then I can reach to a minimum and I can get wonderful results.
Yes. In fact, it was mentioned by Ramal Haniman, the wrong choice of medicine, inexactness, love of peace, and lack of earnestness. So this definitely is the second point, the love of peace, often leading to reading these short material medicas. So that will not give any some much insights. Then again, another thing is that when you examine the Haniman's work, the chronic disease and the material medica pura, the mental symptoms are always given the last, not the beginning. While we take in the case, we try the reverse. We first start the mental symptoms, write the mental symptoms. Why this? Because Hahnemann knows that the patient, the physician will get an idea regarding the patient's mental status or other thing only after talking him with at least half an hour. But we do
Mental symptoms is
this.
like not only like taking, it is perceiving the person, right?
Yes.
He enters the clinic, we start perceiving him, how he walks, how he behaves. That non-verbal communication is also very important part which would help in understanding the patient.
So sticking the basics is very important. Thank you.
Thank you so much.
Most of the doctors are prejudiced that, for example, when a case of this tuberculosis like that come to them, they may think that, oh, it's a case of tuberculosis. I have to think of some tubercular remedies, and so it is better to go in that place. It's pathological prescription is the best here, but these are prejudice. But instead of that, we will have to break ourselves and say to the doctor himself that, oh, I am a doctor, a homeopathic doctor. I need to think in a different way. So in those conditions, then only we will get the right remedy. Interact with the patient. Of course, in the beginning, if you are not getting the clear cut case in front of you, then you can go in that way. But you just wait and see what the patient has to tell and why the patient is hiding these some of his mental aspects. When we try to open up the mind, then we will get the real case, patient, and then we will be able to cure the patient. Anyway, it is the time to wind up the session. I invite Dr. Manoj to say a vote of thanks to the session.
Thank you, Dr. Sanesh. So on behalf of IFPH, expressing sincere thanks to Dr. AMI.C.SHAH and all those participated in this English session. Thank you once again.
Thank you, sir.
Thank you, Dr. Manoj, though, to us attend the session, as well as to the guest of the day, Dr. AMI.C.SHAH. Tomorrow, we will have a session from Dr. Tansila from Pakistan. She will be narrating a case of her a very successful case, one of the successful case from her city. And with that, we come to the day 1576. Thank you all. Good night. It's over to Dr. P. Shaila to moderate the Malayalam session.